Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. First, some of the highlights. Between Abuja and Lagos resume after over 3 months of airspace lockdown. And coronavirus confirmed cases in Nigeria nears 30,000 as country records 503 new cases. University Dawn says 3 strains of COVID-19 currently in the country. Ebonyi State government directs all health workers in the state to undergo compulsory test for coronavirus. And World Health Organization acknowledges emerging evidence that coronavirus may be airborne. Now, confirmed COVID-19 cases in Nigeria are now almost 30,000 as the Nigeria Center for Disease Control (NCDC) announced 503 new infections, bringing the numbers to 29,879. While 12,108 patients have so far recovered from the virus after 280 persons were discharged yesterday. A total of 669 deaths have been recorded. 15 deaths were recorded in 24 hours. The latest cases were recorded in 19 states and the Federal Capital Territory, with Lagos having the highest number of infections at 153, followed by Ondo State with 76 cases. The others are Edo with 54 cases, the FCT 41, Enugu 37, Rivers 30, Benue 24, Osun 20, Kaduna 15, Kwara 13, Abia 9, Borno 8, Plateau State 6, Taraba 5, Ogun and Kano 3 each, Kebbi and Nasarawa 2 each and 1 each in Bayelsa and Gombe State. So far, the top 5 states with the highest cases in Nigeria are Lagos, the Federal Capital Territory, that's the North Central, Oyo, Edo, and Delta States. Over 3 months since the lockdown of the airspace following the coronavirus pandemic, but today flight operations between Abuja and Lagos have resumed. Our aviation correspondent Bukola Jo Kitumbi, who monitored resumption in Lagos, reports that passenger numbers were low when the first flight departed from the domestic wing of the Murtala Mohammed International Airport, Lagos, at 7:36 a.m. with 50% capacity. Passengers were seen with their masks on and observing social distancing and adhering to other COVID-19 protocols. It was gathered that only 5 airlines have been given approval to fly. Meanwhile, in Abuja, passengers were also seen arriving at the Nnamdi Azikiwe International Airport to board flights to Lagos. The Presidential Task Force on COVID-19 gave the go-ahead for the commencement of domestic flights following approval by the President as the second phase of the eased lockdown extended by another 4 weeks. Over in Ebonyi State, the government has directed all its health workers to undergo compulsory tests for COVID-19. The state's Deputy Governor, Kelechi Igwe, disclosed this while addressing local government chairmen at the Government House at Abakaliki, the Ebonyi State capital. According to him, this is to ensure that health workers are safe and in good health while carrying out their duties in ensuring quality healthcare delivery to Ebonyi people. According to him, the local government chairmen would lead the campaign in their different local government areas. Ebonyi State, which has 508 confirmed cases, out of that number, 82 health workers contracted the virus.
With what is happening all over the nation, we will not abdicate on this responsibility of combating this coronavirus in Ebonyi State because our leader and the governor of the state is temporarily in isolation. The Commissioner for Health, together with the CMD and the BAMSEC, Ministry of Health, must make sure that with effect from today, all our health workers must be tested. For how can you go to give care to a man who is sick when you are even more sick than him? Health workers in some places have tested positive of the coronavirus, even in Ebonyi here. So we must be sure that our health workers are safe before giving them the privilege of going to render care to those who are infected.
A bit of correction there. Enugu State has seen 82 health workers contract the virus. Now let's go over to Cross River, where the state government has begun the training of healthcare workers across 18 local government areas of the state on best practices of managing the pandemic. The Director General of the Cross River State Primary Healthcare Development Agency, Dr. Janet Ekpeyong, stated this in Obanliku local government area on a supervisory visit to monitor the exercise. According to her, the training aim is to build capacity of healthcare providers to meet best global practices on various infectious disease management, particularly in the COVID-19 pandemic era.
Currently, we know that there's a global pandemic, which is the COVID-19, and we've also seen that there's the numbers are increasing every day, and it is based on this that the National Primary Healthcare Development Agency, in collaboration, of course, with state government and Cross River State Government, of course, His Excellency Senator Professor Ben Ayade, to see how we can train our health workers in response of COVID-19. The states training, which was initiated, of course, in various states, including Cross River States, from support from National Primary Healthcare Development Agency, started at the state level, and after that, we did a step down at the LGA level, which is across the 18 local governments of Cross River State. Also, we've also did another step down at the ward level to ensure that the 196 wards in Cross River State, they are all fully trained and aware. This is all our efforts to optimize PHC service delivery as well as response against COVID-19 in Cross River State.
Now, over 200 students of the Modibo Adama University of Technology, Yola, are stranded in the campus due to the lockdown and restriction of movement as a result of COVID-19. They are beneficiaries of different palliative donations through the instance of the son of former Vice President Atiku Abubakar, a gesture aimed at alleviating the hardship the students stranded at the university were going through as a result of the restriction of movement, which has now been lifted. The benefiting students were unable to go to their homes in various parts of the country, but they say that the intervention is timely.
I'm so happy. I stay very happy because I've been staying in Sangere and I'm almost broke and they've not paid my dad yet. So I'm so happy I have this.
So at this moment, I want to appreciate my elder brother, my senior leader, in person of Honorable Adamu Atiku, who is the Commissioner of Works at Adamawa State, who donated for us these items that were given to the students like this. It gave me fit to be able to see how young students like this who are stranded, and he decided to see that young people like him as he is will not be able to be suffering this way. So he donated for us the food items, and we decided to go share to the students. As you can see, a lot of joy is happening there.
Now, Professor of Molecular Biology and Genomics, Redeemers University, Nigeria, Professor Christian Happy. He joins us on the program via Skype. We'd like to thank you for joining us at this time.
Thank you for having me on the program.
All right. Now, you have said that there may be more than one strain of COVID-19 in Nigeria. Please explain.
Well, as far back as May last month, May 2020, we identified 3 major strains of viruses circulating in Nigeria. And these were the strain B1, B11, and then B12. And these strains are, and strain A, B11, strain A, and strain B12. Strain A, or lineage A is the one that was originally lineage from Wuhan, and strain B1 from the US, and then strain B11 from Europe. And then this actually showed clearly that the virus came into Nigeria three major sources: Asia, Europe, and America. As I'm speaking to you today, there are 7 strains of the virus circulating in Nigeria. And these strains are, the 7 strains or lineages. These lineages are B11, B136, B110A, B1, and B21. So those are the 7 lineages circulating in the country at the moment. And this is based on whole genome sequences of the SARS-CoV-2 virus that is causing COVID-19 disease.
Professor, what does this inadvertently mean? That are they more potent or less potent in terms of, its ability to spread amongst humans?
Well, the other thing that we found out, and apart from the 7 strain or 7 lineages circulating in Nigeria, is that in the month of May, we first of all raised alarm on the fact that we have 4 samples with the G614 mutant. This is a mutant strain of the virus that has been demonstrated to be highly transmissible. So at that time, we had only 4 based on the sequences that we have. As I'm speaking to you today, based on sequences that we have generated in our lab at the African Center of Excellence for Genomics of Infectious Diseases, ASGID, at Redeemers University in Ede, we have demonstrated now that 71% or 73% of all viruses circulating in Nigeria at the moment are the mutant strain, and this is highly transmissible. So, and then that shows us a strain. That shows clearly that the virus is becoming highly transmissible in this environment, but we are still investigating to see if there is a strong correlation between high transmissibility of the virus and pathogenicity.
Is the Presidential Task Force on COVID-19 aware of the research you've done and looking at some of the measures that they have taken based what they said on scientific data and other analysis? With the extension of the second phase of the eased lockdown, do you think that this is the right time?
Well, this report that I'm getting, the information that I'm giving you to you now are fresh data from my lab, and we're putting a report that we'll be getting to the director of the NCDC today. So we work in close collaboration with the NCDC, one of the testing center for the NCDC in Nigeria, and most report that we produce go to them for the information. We are the only laboratory performing whole genome sequencing in the whole of West Africa. And as such, we also work with the Africa CDC, and we'll be sending this information to them so that they can actually use, the data to actually, the data will inform the policies or the decisions that they can take.
So if you were to advise the government now, should we be easing the lockdown based on what we have on the second phase of the extension of the lockdown ease?
I don't think the idea here is to extend the lockdown, but the idea is actually to enforce, the rules and the safety rules that the government has given. If people, keep wearing the face mask instead of wearing face shield, like the way I see here, if people ensure that they keep washing hands and respect, physical distancing and social distancing, then we should be able to reduce absolutely the transmission of this virus. We are dealing now with a virus that is highly transmissible, more transmissible than the one that we started with. And as such, people should be more careful. People should adhere more to, the rules and regulations given by the government. I believe that with this new information, I think the government should take this very seriously and ensure that, the rules and the guidelines, the safety guidelines are strictly enforced. Otherwise, we'll end up having a situation whereby the number of cases will be skyrocketing. Because as I'm speaking now, I've said 73% of the viruses circulating are highly transmissible virus because of the mutation that happens in the spike protein, in the spike gene. This mutation is located at position 614, and you have a situation whereby an amino acid is changed from, alanine to glycine, so going from D to G, and then this mutation has been demonstrated in the US and in Europe to be associated with high transmissibility.
We'd like to appreciate your time, Professor of Molecular Biology and Genomics, Rowan University. Professor Christian Happy, thank you for joining us on the program. Let's go over to Imo State, where our correspondent Itope Kuteyi brings us this COVID-19 update.
Are now beginning to feel the impact of the extension of the second phase of the East lockdown. Just yesterday, the Imo State Governor Opuzodima lifted the ban on the closure of markets across the state. The governor disclosed it while meeting with members of the Imo State Amalgamated Traders Association at the government house in Owerri. He said markets can now commence operation on Mondays, Wednesdays and Fridays. He said this action is necessary in order to ensure that the Imo State economy is not completely crippled. He also said this is to help business owners who have recorded huge loss during the lockdown.
I called the meeting, first of all, to thank you for your cooperation. After the first time we met, and they committed that you will close the market and you will comply with the protocols of COVID-19. We will not continue with the policies that will inconvenience the market interest and the traders' interest. We must, from time to time, find ways of relaxing those areas that have attracted hardship and almost disturbed day-to-day business activity. Because beyond everything, we need an economy. We need also to encourage you to be in business. So I have nothing against relaxing some of the measures, which will include allowing the markets to open. I want you to assure me that the way you have cooperated for the past 3-4 months, that you will also extend that cooperation to compliance with the COVID-19 protocol.
Even though the markets are now open, but the governor insisted that the traders must comply with the rules and regulations put in place by the NCDC and the state government to contain the spread of the virus. From Owerri, the Imo State capital, Itope Kuteyi, for COVID-19 update.
Sickle cell disease is a major concern of public health significance in Africa. Nearly 2/3 of the global burden of sickle cell disease is found to be in sub-Saharan Africa. There is increased mortality risk in the disease, with patients in Africa due to associated complications such as acute chest syndrome, asthma, and others. As a result of COVID-19, infections are higher as these patients are immunocompromised and may be at risk, high risk of mortality. To help us understand the new normal for these patients, we have Dr. Annette Akinshete, National Coordinator, Chief Executive Officer of Sickle Cell Foundation, Nigeria. She's also a public health physician. She joins us here in Lagos. Thank you for joining us.
Thank you. Thank you for having me.
All right. First, explain to us the common clinical manifestations in a sickle cell patient and how this changes.
Can I just kind of set the stage? Because this year, last month, we celebrated World Sickle Cell Day on 19th June. And the theme this year has been sickle cell and COVID-19. Okay, sickle cell falls into the category of conditions that we say are comorbidities, pre-existing conditions. So they're actually more vulnerable to getting infections generally. And that's because the spleen, an organ of immunity that we have in our abdomen, and their white blood cells are compromised. So they're impaired. So they're not able to fight infection the way the general population would. And also we find that their levels of vitamin D, which you have seen now, helps us with immunity, helps us boost our immunities. The levels of vitamin D are also low. For all these reasons, they're generally more vulnerable to infections, whether viral, bacterial, malaria, or any parasites and so on. And definitely in this era, COVID-19. So we're very particular about how we take care of them. And here in Nigeria, and I think in fact globally, we have been on very high alert since the pandemic came on stream. So, and we've kept tab of all our persons who have sickle cell. There's this concept I've always talked about of called shielding. That is, in addition to all of the precautions and precautionary measures that are out there, you know, social distancing and all that, shielding is an extra layer of protection that ensures that people with sickle cell, and perhaps even others who have comorbidities, restrict the interaction with other people as much as possible. And during the lockdown, it was a case of stay at home, go nowhere. And so their medicines, foods, and other things were taken to them in their home. So therefore know that will require a lot of support from the community, from family, from friends, from church.
Exactly,
and
because they have to work, for those that work.
For those who have to work.
And those that go to school.
So now, you know, the reason we're even talking about this now is that children are going back to school. What are the things that have to be in place in school? So this one thing we've learned during this COVID pandemic response is the need for us to work across the sectors, work in concert, work synergistically, in harmony, you know what I mean? Like, it's the systems. We work as a system, not necessarily in compartments. So we have written, Sickle Cell Foundation Nigeria has written to Lagos State Ministry of Health. We've also written to the Federal Ministry of Health with guidelines for keeping persons who have sickle cell safe during this time as they go back to school and also as they go back to work. Many are already working. We have a couple of them in my place of work. How do you keep them safe? Those shielding measures, that is, keep them safe at home. Even at home, you do not share cutlery, you don't share towels, you stay in open places if you can afford it, stay in a room of your own. If you can afford it, and if you can't afford it and in a room of your own, stay in a bed by yourself, you don't share anything. So keep rooms ventilated. All those things we now have to move to the workplace or move to the school as well. Right. But that means teachers and parents have to work together, not only in the school. Remember also that children have to commute back and forth. What measures are in place? You see why the systems have to work together. Education, health, transportation, and all that. In school, well, we're lucky that now it's only those who are in the graduating classes that have to go back. So in terms of space, I'm not so much concerned. They'll be able to put children in different classes and have them spaced out. The problem is when all the full complement of children return. How do you make that happen? For those with sickle cell, we are teaching teachers to help them come forward out of, if they can't maintain the 6 feet, bring them to the front of a class where there's more space. So we just have to be creative and adapt to the situation we find ourselves in. Right. If there are corridors or verandas, utilize them. Open windows, let them take short breaks. And get
a lot of measures there that need to be in place.
Yes.
We appreciate your time, Dr. Annette Akinshete, National Director and Chief Executive Officer, Sickle Cell Foundation Nigeria. Thank you for joining us on the program.
Thank you very much for having me.
The World Health Organization has recognized that there is evidence emerging of airborne transmission of COVID-19, which could lead to changes of guidance on distancing. The acknowledgement comes as Melbourne in Australia imposes another lockdown amid a surge in infections.
The Australian state of Victoria has confirmed 134 new cases of coronavirus, with Melbourne due to begin a 6-week lockdown after a surge in cases. About 4.9 million people in the country's second biggest city will be confined to their homes for all but essential activities. Over in the United States, California and Texas have reported more than 10,000 new cases in a day.
That's the vital importance of safety. And
despite this, President Donald Trump says he thinks the U.S. is in a good place and he would pressure state governors to open schools in the fall.
There are hundreds, many of you with your hands.
In other developments, the World Health Organization says there is emerging evidence the virus can spread through particles in the air. The WHO has so far said that the virus is transmitted through droplets when people cough or sneeze. If the evidence is confirmed, it may affect guidelines for indoor spaces.
The message from the NCDC is to take responsibility to protecting your health. You can find more information on their website. It has the latest updates on the disease situation across the country. From the World Health Organization, your questions are answered as to the countries, the latest global numbers, and of course, country of COVID-19 cases on a daily basis. You can take a closer look at some of the numbers in real time. Our website, channelstv.com, has the latest news. All you need to do is log on. We have the FEC virtually meeting that's holding virtually. You can see there. There's so many other stories. Log on to our website, channelstv.com. That's a COVID-19 update. Thank you for watching. I'm Millicent Walker. Bye for now.